Hello, everyone. My name is Sarah Leahy, and I work for the Colorado Rural Health Center. I hope everyone is enjoying their Practice Essentials workshop. I know it's being done virtually this year, and although I would really love to see all your faces and be able to connect with you face-to-face, I am grateful for the opportunity to speak with you today and to let you know a little bit more about the opportunities we have with Colorado Provider Recruitment and about the Colorado Rural Health Center, and hopefully give you some information about job opportunities and how you can connect with me and others for jobs after you are finished with your residency program. So I'll just speak briefly for 10 or 15 minutes about our organization and our program, and I know that Gina would be happy to provide my contact information afterwards if anyone would like to connect. So I'm going to go ahead and hide my camera so you guys can focus a little bit more on the presentation. So again, my name is Sarah, and I work for an organization called the Colorado Rural Health Center. Today, we're going to provide some information about rural practice here in Colorado, and again, how you can find a job in a rural or an underserved area of Colorado. Before we get started, just a little bit of information about the Colorado Rural Health Center. As you can see, our mission is to serve rural Colorado and help them get the resources and the care that they need to their patient population. We do that in many different ways. We have lots of different services and programs to help serve our members, which are mainly rural hospitals and rural health clinics all over the state. Some of those services that we have include quality improvement to help expand access to care for patients, technical assistance. Lots of the facilities that we serve must abide by many compliance, regulatory rules and regs and conditions of participation to stay in compliance for their programs. So we provide that technical support to them. Workforce, so we'll talk a little bit more about our provider recruitment and retention program later. HIT support and telehealth support. We facilitate several educational events, including 2 conferences each year, and policy and advocacy. So where is rural Colorado? As you can see from this map, it is over 2/3 of the state. The white areas, the counties that are white are urban counties. The light blue is rural, and the frontier is dark blue. Rural counties are counties that do not have a town of 50,000 people or greater, and frontier can be defined as a county having an average of 6 people or less per square mile. So what about the clinics and the hospitals that are in rural Colorado? There are all different types of clinics, especially in the state, that are options for you all to work at. And the reason I'd like to bring this up during the presentation is I would love the opportunity to just let you know that there are different options out there for you to work after residency. Many other options other than suburban health systems and those big urban hospital systems. Rural practice offer lots of different options. Certified rural health clinics can look very differently across the state. Many are independent, freestanding clinics. Others are provider-based, which means they're under the umbrella of a hospital, under a critical access hospital or a larger rural hospital. They receive some enhanced Medicaid reimbursement since they serve a largely underserved population. Some of the great things about rural health clinics is the uniqueness of them. Many are solo practices, some are multidisciplinary practices. Again, some are part of the hospital, some are private, some are even owned by the county or are run through a mill levy. So there are lots of different settings in these rural health clinics. Another type of facility that we serve are called critical access hospitals. So these are small rural hospitals with 35 beds or less. They are normally near a mountainous terrain. and there's a certain mileage that they have to be to the closest other rural hospital. We also serve community health centers and other safety net providers. So what about rural practice? I know that there are, and I'm sure that you have heard, there are lots of benefits and challenges when it comes to rural practice. And honestly, it really isn't for everyone. But some of the things that I hear about the most, especially when it comes to the challenges, are things that also are a benefit. They really do force creativity, community collaboration. You have to be adaptable to work at these clinics. And it ensures that you are keeping up with the times, that you provide teamwork and work as a team and integrate. Like I said, it's not for everyone, and you have to meet many challenges to work in a rural practice, but that's why people love it. Some of those specific challenges include access to specialty care, and many times that's because of the diversity of patients that folks are seeing. It's a largely underserved population, so patients are older, they're sicker, and they are poorer, which does present many challenges. There tends to be professional isolation when you're out there. There aren't as many providers, so it's easy to get in that realm of isolation. Luckily for us, and one of the silver linings with COVID-19 is the advancements in technology. So you do have lots of other resources to ensure that isolation doesn't take over. Call coverage. There tends to be a heavier call coverage, although many of our members work very hard to mitigate this, to bring in locums, and to make sure that they have the workforce necessary so that you are still able to have that lifestyle and benefits of a rural lifestyle that you want. Workforce shortages, and I kind of went over that as well. There absolutely is a workforce shortage in rural Colorado. Some of the benefits that I hear about most are your scope of practice. One of the best things about working in a rural facility is that you are actually able to practice what you are training for right now. You are not doing routine medicine. You are seeing lots of challenging cases, like diversity of patients. You see new things every day. And although there's professional isolation, I will say that you have a great connection with other providers in your area, within your facility, within your community, within your county, and in other rural areas. You have a network of other rural providers that are able to support you, and you're able to support them. The specialists that are in your community or in your hospital are your friends, are your allies, are your colleagues, and it's very easy to connect with them. They are not in another huge urban system or within the same system. You're not competing with them. Again, you are there to work together for your patients. You really do have an extremely personal connection with your patients. You know them from the time they're born to the time they die. You know their family history because you know their families, and you have the time to connect with them. You tend to have greater autonomy. Like I said, there aren't as many of you, so you do play a leadership role in whatever role you're in your practice. There's opportunity for involvement in your community and for leadership opportunities. Many times, rural physicians and family medicine physicians take on a leadership role throughout their career. There's also financial incentives, such as loan repayment and the rural and frontier preceptor tax credit. And most importantly, you truly do make an impact. You can change the way healthcare is delivered in your community and in your town, in your county, not only for your family, but for your patients. So how do you find a job in a rural area? The program that I help oversee is called Colorado Provider Recruitment, and we assist family physicians in finding jobs in rural and underserved areas. Our job is to help you make a connection with a career that you stay with. I'm sure by now you have been stalked by headhunters and recruiting firms and job boards. You are well sought sought after physicians, and that's because of the extremely valuable part you play in healthcare. I like to think that our program is different, and the mission of our organization is to help reduce that workforce shortage. Helping you find a job is a huge success for our program. So we have a job board on our website, coruralhealth.org, and on 3RNet, which is our national rural recruitment and retention network. And they are programs similar to ours, but on the national level. So if you are looking to work outside of Colorado, which I hope that you are interested in staying here in our state, but if you are looking at going outside of the state, please check out 3RNet as well, because there are folks just like myself in every state in the country that have a focus on rural and underserved practice and helping providers find those more mission-driven careers. So when you have an opportunity or a chance, please check out our website, look at the different jobs that are available on there. We try to help our employers that are posting jobs put as many details into their job descriptions as possible, including the salary, the scope of work, the different quality improvement programs that are involved with, what their call coverage is, if they're eligible for loan repayment, all of those different types of details. And if they're not in the job description, you can give me a call and I can connect you directly with that employer or help answer your questions. I will be giving Gina some other resources around those loan repayment programs and the tax credit financial incentives, so that you have those to refer to throughout your residency and afterwards. And again, if you have questions about those, I can either answer them or I can put you in touch with our state public health state health department, who facilitates our loan repayment program. And that's it. Short and sweet. Here's my contact information. And actually, I apologize, this isn't updated. This is my office phone number that's listed. My cell phone number, I am remote now completely. So my cell phone number is area code 518-577-7746, but you can reach me at that email address. Feel free to call me anytime. Thank you again for your attention, and we hope to see you soon in rural Colorado.